GOP pessimism grows over any deal to extend expiring health care subsidies, by Alexander Bolton. Senate Republicans do not see a bipartisan deal to extend enhanced health insurance premium subsidies coming together before the Christmas deadline, given the complexity of the issue and a growing fight over abortion, an issue that deeply divides both parties. There is a solid group of Republican lawmakers in both the Senate and House who do not want to see the enhanced subsidies under the Affordable Care Act ACA expire at the end of the month. Many more, however, view Obamacare as irretrievably broken and an extension of beefed-up subsidies as policy heresy. That fracture within the party makes it very difficult to move legislation and is a reason for the GOP pessimism. Senate Majority Leader John Thune, Republican from South Dakota, acknowledged the lack of progress Monday. "My assumption is that by next week when we have to have that vote, that we might not be far enough along on the bipartisan discussions," he told reporters. Thune said the conversations are still active on a solution, but he warned there are some significant sticking points. The GOP leader highlighted an escalating fight over adding language to any bill extending the subsidies to ensure federal money is not spent on abortion care. "Dealing with Hyde is a big issue, obviously, for both sides," Thune said, referring to language that prohibits taxpayers' money being spent on abortions and is named after former Representative Henry Hyde, Republican from Illinois. Democrats argue that under current law, the subsidies do not fund abortions, but Republicans want stricter safeguards and to apply the Hyde Amendment, which prohibits federal funding of abortion, more directly to the health insurance marketplace. Senator Tammy Baldwin, Wisconsin, a leading Democratic voice on health care policy who has participated in Senate negotiations on the issue, said she does not support attaching new abortion-related language to federal insurance subsidies. "When we enacted the ACA, there were safeguards related to the tax credits, and they have been sufficient, and they remain sufficient to my mind. So I would not see supporting any additional limitations," she said Monday while heading into the weekly Democratic leadership meeting. "I am certainly involved in the talks always," she added. Senator Elizabeth Warren Mass, another member of the Senate Democratic leadership team, said neither Senate Republican leaders nor the White House have presented any substantive proposals to keep the enhanced subsidies from expiring. "There are no Republicans willing to negotiate over this. None. Where is Donald Trump? Where is the Republican leadership in the House or the Senate? None of them want to talk about health care assistance for American families," she said. "They do not want to talk to the Democrats about that. They want to go off and engage in some fantasy conversation with each other about people who can afford to pay for health care. They have voted to cut health care, and they do not want to reverse those cuts," she added. Senate Republican Whip John Barrasso, Wyoming, on Monday cast doubt on getting a bipartisan deal before Christmas, asserting Democrats have not yet agreed on a proposal to extend the subsidies. "The Democrats have not even come up with a proposal. The House wants 3 years, someone wants a permanent extension, they do not know what they want," he said. White House advisors last week floated a plan to extend the expiring subsidies temporarily, while also reforming the program by imposing an income cap on individuals and families who qualify and cracking down on what Republicans say is rampant fraud. But Trump last week distanced himself from the proposal after getting pushback from Speaker Mike Johnson, Republican from Louisiana, and House conservatives. "I would rather not extend them at all," Trump said shortly before Thanksgiving, though he acknowledged that some kind of extension might be necessary to get something done. Speaker Johnson warned Trump advisors in a phone call last week that extending the enhanced ACA subsidies faced strong opposition within the House GOP conference. Thune told reporters Monday that there is interest among some Republican senators in extending the subsidies and reforming the ACA health insurance marketplace. "We have a lot of interest on our side, and a lot of good ideas that go back to try and address what we think are some of the underlying problems with Obamacare in the first place. One being affordability, the fact that premiums continue to escalate year over year, and we think that has a lot to do with the way it is structured and how it incentivizes insurance companies to cover people," Thune said Monday evening. Senator Josh Hawley, Republican from Missouri, is warning that the expiration of enhanced subsidies would impact nearly 500,000 people in his home state. "We cannot just allow the premium support to expire," he warned last month. Senate Health, Education, Labor, and Pensions Committee Chair Bill Cassidy, Republican from Louisiana, is working on legislation to convert the ACA's premium tax credits into contributions to health savings accounts that could be used to defray out-of-pocket health care costs, according to an analysis of his plan by health care research nonprofit KFF. That proposal has already run into Democratic opposition. "We insist that the ACA tax credits have to be renewed and extended, period. If Cassidy's proposal, as I understand it, replaces them, that looks like it is privatizing health insurance, and looks like it is really problematic, Senate Democratic leader Chuck Schumer, Democrat from New York, told reporters before the Thanksgiving recess. House Democrats are circulating a discharge petition to force a vote in the lower chamber on legislation to extend the enhanced health insurance subsidies for 3 years. But Republican leaders are skeptical that Democrats can get the 218 signatures to force a vote. And even if they prevail in the House, there is no guarantee that legislation to extend the subsidies without significant reforms could get the 60 votes needed to pass the Senate.